A study just dropped. 40,000 people, 15 years of data. Eating eggs 5 times a week is associated with a 27% lower risk of Alzheimer's. Published in the Journal of Nutrition out of Loma Linda University, this study has been peer-reviewed. But here's the thing, CBS did not cover it, NBC did not cover it, and ABC did not cover it. The only TV coverage I could find came from a news channel out of India. And here's the thing, the average evening news viewer in America is over the age of 65. That is the exact population this study is about. And none of them heard about it. Today, I'm going to show you the study, and then I'm going to tell you why it never made it to your TV. Here's what the study found. Researchers at Loma Linda University followed 39,500 adults aged 65 years and older for an average of 15 years. They tracked how many eggs each person ate, then linked that to an Alzheimer's diagnosis in the Medicare records. Almost 3,000 participants developed Alzheimer's during this 15-year study. The results show a dose response. The more eggs people ate, the lower their risk for Alzheimer's. 1 to 3 eggs a month showed a 17% lower risk. 2 to 4 eggs a week, a 20% reduction. And 5 or more eggs a week resulted in a 27% reduction in Alzheimer's. That pattern matters in the research. It suggests a real biological effect, not just noise from the data. So what is it about eggs? Well, choline is the headline. Your body uses it to make acetylcholine, the neurotransmitter tied to memory. Deficiencies in choline have been well documented in brains with Alzheimer's. Then there's also DHA. That is the omega-3 fatty acid your brain depends on. Also, it is deficient in brains that have Alzheimer's. I wrote about DHA and fish oil in last week's newsletter. I'll put a link in the description. And then there are the phospholipids in the egg yolks. They make up nearly 30% of the total egg lipids. They are critical for how your neurotransmitters work. These nutrients do not work alone. They work together. That's why the whole egg matters. But before I go any further, there are 3 things I want you to know about this study. First, this is observational data. It shows association. It cannot prove that eggs prevent Alzheimer's. That distinction really matters. I'm going to say associated with in this video, not prevents. You should hold the same standard for any nutritional research you read. Second is the population of the study. The study looked at 7-day Adventists. This is a religious group and they smoke less, they drink less, they eat more plants. The lead author even said it in the paper. Seventh-day Adventists do eat a healthier diet than the general public. So adding eggs to an already healthy diet may not produce the same results as adding eggs to the typical standard American diet. And then lastly, the funding. Some of the funding came from the American Egg Board. The study says the Egg Board had no role in the design, the execution, or the publication. The PubMed Conflict of Interest statement says the authors report 0 conflicts. But I think you should know who helped pay for this study. This is the part that really bothers me. About 20 million Americans watch the evening news every night. The median viewer is over the age of 65, and this study is about adults 65 and older. It is a direct match, and yet not one major network covered it. And I've been thinking about the why, and there's really 4 reasons I'd like to discuss. The first is that Observational studies are treated almost as second-class research. If a pharmaceutical company publishes a double-blind drug trial showing a 27% reduction in Alzheimer's, it would lead the broadcast. But a nutrition study with the same number from 40,000 people over 15 years does not get the same treatment. The editorial bias in television news is towards drugs, devices, and interventions that you can buy. It's not interested in promoting food. The second is that the egg board funding scares news editors. The moment an editorial desk sees industry funding, they hesitate. They don't want to look like they're running a commercial for the egg industry. Even when the study is peer-reviewed, published in a respected journal, and the funders have been proven to have no role in the research, that nuance gets lost at the assignment desk. The third is that prevention does not have a news hook. There's no patient story. There's no hospital footage. There's no FDA approval headline. Eat eggs is not dramatic television. Prevention research is hard to produce for a news broadcast that the system is built around treatment, not prevention. And fourth and finally, we have to follow the money. Pharmaceutical companies spent $7 billion on television advertising in 2025. The United States is one of only 2 countries in the entire world that allows drug companies to advertise directly to consumers on television. The other country is New Zealand. Every other country in the world has banned pharmaceutical companies from running commercials. When your biggest advertisers are pharmaceutical companies, you are less likely to run a segment that says an egg might do something their pharmaceutical product does. Nobody in the newsroom says that aloud, but the incentive structure is very real, and it affects what information actually reaches you. This is not the first time I have covered prevention research that did not make the evening news. Dr. Lisa Marconi's brain scans showed that choline needs increase during the menopausal transition in women. This egg study adds population-level data to what she showed in her laboratory. The Scherze's built an entire prevention program around nutrition as one of the 5 pillars. Eggs fit directly into their framework. And the Alzheimer's Association 2026 report found that only 1 in 10 adults over the age of 40 had heard of the U.S. Pointer study, the first large-scale trial to prove that lifestyle changes, including diet, protect cognitive function. The pattern is the same every time. The prevention data exists, it's just not reaching the people. Now, here's my implementation rating for this study. What I'm rating is how easy it is for you to actually take action on this information tomorrow. Can you actually do something with it? And this one scores high. You do not need a prescription. You do not need special equipment. You do not need a doctor's appointment. Eggs are available at every grocery store in the country. You can scramble 2 eggs in about 3 to 5 minutes. The dose response is clear. 5 or more eggs per week is the strongest association. Where it loses points is on the certainty. This is an observational study. I cannot tell you that eating eggs will prevent Alzheimer's. I can tell you there is a strong, consistent association across multiple studies. That is meaningful, but it is not a guarantee. So my rating is going to be 4 out of 5. The intervention is affordable, it's simple, and it's backed by 2 independent studies in the past 2 years. The only thing keeping it from a 5 is that we are waiting on a clinical trial to confirm actual causation. but in terms of doing something you can do tomorrow with almost no friction. This is one of the strongest findings this channel has ever covered. So here's what you need to do with the information. If you already eat eggs, keep going. The data says 5 or more per week is the strongest association. Also, eat the whole egg. The yolk is where the phospholipids and most of the choline live. Egg whites alone miss the point. And if you can, buy pastured eggs. Pastured means the hens lived outside. They ate insects and plants and got sunlight. Those eggs have higher levels of the nutrient this study is about. More choline, more DHA, more of the fat-soluble vitamins your brain uses. A dozen of pastured eggs cost about $8 here in North Carolina. That is less than $1 an egg. Still cheaper than any supplement or insurance copay. Let me be clear, eggs are not a magic fix. They are one food in a broader pattern. Pair them with the other things the research supports: movement, sleep, cognitive engagement. This is one piece, not the whole picture. A 40,000 person study over 15 years found that eating eggs 5 times a week is associated with 27% lower Alzheimer's risk. And the majority of the major news networks did not cover it. The data is there. It is just not reaching the people through the channels they trust. That's why this channel exists. I read the studies, I tell you what they found, and I tell you what you can actually do about it. If that sounds useful, please subscribe. I publish a new video every week. I also write a newsletter that goes deeper onto these topics, and there's a link in the description. If you are watching this and thinking, I want help building a plan for my brain health, well, that is what I actually do. I'm a health and wellness coach. There's a link in the description for you to book a call so you can learn more about us potentially working together. Thank you so much for your time, and I will see you next week.